So now the face is completely marked up, we're then going to use the preset settings that we actually have on the HIFU system. So the HIFU comes with a treatment chart that includes your neck, chin, jaw, nasolabial lines, cheek, under eye, side of eye, forehead. When looking at how we're going to be treating a client, what we look for is the problem areas or the areas that specifically we may want to treat. So for a lot of clients, there is the double chin that may exist underneath the jaw itself. So through this region here, you may have the jowl area. If there's a sagging jowl, that's another area specifically people may want to treat. Deep nasolabial folds and creases is another section people want to treat, and also then through the forehead and the crepiness that may exist in the neck. So when we look at our treatments themselves, what we want to ascertain is, are we looking for a lift, so lifting the entire face, or are we looking for volume reduction, or are we looking for both, or are we looking for a glow without volume reduction? Keeping in mind, you may have clients with sunken cheeks. That whole sunken cheek look, you do not want to take away extra volume, but what you do want to do is potentially a SMAS lift. So by using the deeper depth, that is where we're targeting the SMAS layer. So on the protocols themselves, you'll see the deeper depth, which is your first pass, and then the second pass, which is for volume reduction. The third pass, which is potentially done, is the 1.5mm HIFU glow, and that is to get rid of fine lines and wrinkles that may exist around the side of eye, under eye, and other regions like that. So understanding the deeper depth is for the SMAS lift, the shallower depth, or second pass depth, is for the subcutaneous fat volume reduction, and then the HIFU glow is for superficial fine lines and creases. So looking at those three, you then ascertain how you wish to treat the client. So when we're preparing our client, what we'll then do is ensure the face is marked up correctly, and then we'll start with the neck. So we'll actually work from the neck up. So what we then do is we'll actually adjust the machine for our first settings. So you go into your interface, you'll select your frequency as per the treatment sheet, you'll then select the depth as per the treatment sheet, and then your energy as per the treatment sheet. So what we're going to do now is we're actually going to cover the motions required to do the treatment. So what we're actually going to be doing is small circular overlapping motions. So once your machine is ready and it's in standard mode, you will then use small circular motions. So what we're going to be doing, ensuring there's gel on the handpiece itself, gel on the client's neck. You need the ultrasound gel to ensure that you get good contact during the treatment area. So then what we do is we actually put the transducer on, and we're going to be working in a slow circular motion. So the timing of each circle should be 1, 2, 3, 1, 2, 3, 1, 2, 3. So ensure gel is covered over the area well. This is absolutely mandatory. Without good gel conductivity, you will not get the ultrasound energy being deposited in the skin itself. So the motion, again, circular motion. 1, 2, 3, 1, 2, 3. Not hard pressure either. So what we're looking for is even, firm pressure, but not hard. The whole purpose of the pressure is to ensure good contact on the skin. So left to right, circular motions. Overlapping, moving left to right. So what you then want to do is completely cover the area with the required number of shots. Okay, so that is the motion that we're going to be doing. So 1, 2, 3, 1, 2, 3, motion. Take it all the way so that the overlapping sections of the lines we've marked will start to blur. So for the neck, overlap, deeper depth first. What you can then do is go straight to the other side. Same circular motion, nice and slow, even pressure as you work over the region itself. Again, deeper depth first. After completing the required number of passes, so what you want to do is cover that entire area with 3 passes. So I'll show you in real time. So 1, all the way up under the ear, and down back across. So I'm on my second pass going back. Then I'm on my third pass, coming back up. So that is the entire treatment, small circular motions, covering that area. Okay, So to current protocols, that is about 800 shots. You can increase the number of shots required if the patient has a longer neck. You do the deeper depth first, and then you repeat exactly the same motions, exactly the same speed, and exactly the same number of shots at the shallower depth. So again, instantly, as soon as you finish the first pass, change the depth, change your settings, repeat the motion. What this enables is to maintain thermal response through that region, delivering the required number of shots into that area. Remember, 3 complete slow passes. It should be a minimum at this stage of about 800 shots per side. One side, 2 sides. So 800 shots, 800 shots. The next we'll look at is then under the chin area. So the motion is exactly the same when we're treating under the chin. So currently we look at a coverage using small circular motions, nice and slow, all the way up under the chin, good ultrasound gel coverage. Small circular motions, working back and forwards, covering the area, overlapping again slightly into the neck region, not going down over the larynx, however. So you can actually treat the chin in 2 separate areas. So you can actually break it into halves, or when you get more confident, you can treat it as one overall area. So in this case for the training, I'll just show you in halves. So again, working small, circular, overlapping motions, ensuring that we keep contact with the skin. Remember, when we're treating, do not roll the head. You move it flat, so it stays flat against the skin in small circular motions. Also, to get a line down the jaw, so once we finish the required number of shots, you can actually then do another pass down under the jaw itself and back. What that does is actually works just inside the jawbone itself to give it more of a defined shape and lifting underneath the chin itself. So again, small circular motions for the required number of shots. Backwards and forwards. And then you can finish it with a line all the way up under the chin itself. Keeping contact, keeping good gel. So if you also then have a stubborn under chin area, so the large pocket of skin and soft tissue that can exist under the chin, you can, once you've completed both sides or during the treatment, do it an extra approximately 100 shots over this region itself. Smooth, circular motions. So what we want to ensure is an even coverage across the entire regions themselves. Again, keeping that motion nice and slow and even pressure across the region itself. So after we finish the neck, 2 depths, chin, 2 depths, we move on to the jaw. So again, the jaw is the same circular motions, back and forwards. See, small circles, back again, small circles. What we're doing is we're aiming to overlap and cover the entire area of treatment. So ensure you have plenty of gel on the handpiece itself. You need the gel for contact. So if you run out, you can then add more. Use your scraper to actually relocate the gel from the lower regions up the face that you may need to. So once we've got some more gel in, that's small circular motions through the jaw area itself. So 1, 2, 3, 1, 2, 3, small circular motions. Okay? Using the required number of shots, deeper depth first, then shallower depth. We then move on to the nasolabial fold. So the nasolabial fold we do slightly differently. So again, we can actually do small circular motions up the fold, but what I also then do is I actually do a line straight up and down on my second pass. So circle, 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 line, line, straight down the nasolabial fold. What this does is helps to lift that crease and break down the soft tissue either side of the crease for a more even texture. So to cover the nasolabial fold again, small circular motions, down, down, small circular motions. Okay, using the required number of shots, covering the region like that. So that is the key part that we're looking at. So you repeat for the other side. Remember, deeper depth first, switch to shallower depth, then switch to the other side, and repeat. So the whole philosophy around what we're doing is colouring, overlapping the regions themselves. Now, the next region we look at is the under eye. The under eye is a little bit trickier. So what I'm going to do is I'm actually going to show you how the under eye works. So with the under eye itself, you may need a tissue, you may need some paper towel, but what we want to do is selecting our depth for the under eye treatment. We then start with the 3 millimeters in this case, and we actually extend the skin down. So when we extend the skin down, what we're doing is we're actually putting the transducer onto the orbit bone itself. So not on the eye, not down on the cheek, but you'll actually find when you pull the tissue down, you can actually notch the transducer onto the orbit bone. So what we're then going to do with this treatment is we extend the skin, we put the transducer on the orbit bone, and you move it backwards and forwards across that region, releasing the skin. What this effectively does is pulls different skin down on the treatment area and then relaxes to move the skin back up. Again, depending on where you pull down on the face itself, using firm pressure, you can actually extend the skin, as we can see here, down onto the orbit bone. We notch in and treat and release. Extend, release. So what we're effectively doing is moving the skin over the orbit bone for the treatment area. The key thing with all treatments, never leave the transducer in a stationary position. If you finish treating a line, release, reposition, press the button as you're moving. Do not hold it in one position, ever. So if you're doing the under eye and side of eye as part of a full face treatment, you can actually then continue round on the shallower depth, all the way round to the side of eye itself. So you can actually bring it round here and up, keeping away from the temporal region itself. So you can also use, for the side of eye treatment, small circular motions for a required number of shots, depending on how many creases and wrinkles we have to deal with. So too, when we move on to the forehead, it's done in small circular motions, working up, down. Same speed that we've done with the rest of the face. So the key thing with the forehead is when we're ascertaining what depth to treat, you would not generally treat both depths at 2 mil and 1.5 mil. What we're looking for is basically rebound on the forehead. So you'll see here, there's no soft tissue rebound. With some clients, you'll actually leave an indentation when pushing down on the forehead. For those clients, what you may want to do is a 2 mil before you do the 1.5 mil. For that reason, it actually does the volume reduction on the soft tissue on the forehead. But for all other clients, if there is no rebound, you'll do a pure 1.5 millimeters. And again, that's in a 1.5 millimeter depth, small circular motions, keeping parallel to the actual skin surface itself, moving up and down over the region in small circular motions, keeping good contact, rolling the wrist, not the head. Small circular motions, completing the forehead. One pass is all that is needed at the 1.5 millimeters. So basically we'd look at 400 shots, one pass, start again back the other way, 2 passes, start again back the other way, 3 passes, and that is it for the entire forehead. You may need to adjust the energy on the forehead treatments depending on your patient's or client's tolerance to pain, because the forehead is one of the most painful areas to do, or discomforting areas to do, because there is bone directly beneath it. Hence why we only tend to do 1.5 millimeters on this region. So too, if you want to treat the eyelid themselves, do not treat over the eye, but you can extend the eyelid over the top and actually treating across the top of the eye by extending the skin up. So what you would do is extend, across, back, release. Extend, across, back, release. Extend, cross, back, release. That's it. 3 times is all you do. So what we've done there is effectively marked up the face and then done the complete treatment from beginning to end, working all the way up. So a couple of little tips and tricks. What we should get is a little tiny bit of redness through the treatment area on most clients. It won't happen with every client, but the key thing is 3 complete passes in these regions, minimum, of overlapping circles. So if you're not getting those 3 passes in generally the number of shots, you're moving too fast. So the shot guide that we have is typically a minimum. You can treat more than that, depending on the thickness of the soft tissue and the desired outcome. If you have a client with sunken cheeks and you do not wish to reduce the volume there, do not treat the area. So just treat around it, but don't treat the actual area itself. So that is how we do a full face and neck treatment, working slowly and methodically over the entire regions after we've marked up the face.